Good morning, ma'am. I'm Dr. Darly Polito. How would you like me to call you?
Good morning, Doc. I am Anna.
Okay, Anna. Now, before we start, I would like to ask some questions and your history to better understand your condition.
Good rapport creates a close and harmonious relationship with patient. Explain the purpose of the interview and get the patient's consent.
I assure you that all information gathered here will be within our medical team. Is that okay with you?
Yes, Doc.
Okay, let's start. What's your full name, Anna?
Juana de la Cruz.
Note the day and time you assess the
Your
patient.
marital status?
Note the
I
gender
am
of the
single.
patient. The patient is alert, comfortable, well-groomed, appropriately dressed, and cheerful. Grooming and personal hygiene may deteriorate in depression, schizophrenia, and dementia. Excessive fastidiousness may be seen with obsessive-compulsive disorder. Speech is fluent and words are clear. Note the slow speech of depression, the accelerated, louder speech of mania. The patient's mood is relaxed with an appropriate affect with his response and not emotionally labile. Check the mood range of patients from sadness and melancholy, contentment, joy, euphoria, and elation.
Do you see things that others might interpret differently?
I don't think so, Doc.
Now, do you see or hear things that I might not be able to see or hear?
No, there's nothing.
Now, do you have any persistent beliefs that might be quite different? For example, do you feel like there's people trying to harm you?
No, none.
Illusions may occur in grief reactions, delirium, acute and post-traumatic stress disorders, and schizophrenia. The patient is awake, alert, and aware of his surroundings. Patient who has a disorder of consciousness, disorientation, amnesia, misperceptions, hallucinations, often vivid delusions. We could use the GCS to assess the patient.
Please subtract 7 from 100 until I tell you to stop.
193, 86, 79, 72.
Okay, stop.
The causes of poor performance in attention includes delirium, dementia, intellectual disability, and performance anxiety.
Now, can you tell me the date today,
20,
the month,
March,
the year,
2021.
the day of
The
the
patient's score here is 5 over 5,
you
which
estimate
means
the
the
time of
patient
the day?
answers the
10
questions
a.m. in the
correctly.
morning.
This orientation is common when memory or attention is impaired, such as in the case of delirium.
Now, I will ask you to remember 3 words, mango, table, and coin. Can you repeat them for me?
Mango, table, and coin.
Recent memory is impaired in dementia and delirium.
Now, keep the 3 words in mind as I will ask you them what they are. When is your birthday?
January 12, 1998.
The last school you attended?
UNP.
Now, at the beginning, I asked you to remember 3 words. Can you tell me what they are?
Mango, table, coin.
On the other hand, remote memory may be impaired in the last stages of dementia.
Can you name me the last 4 presidents of the Philippines?
Benigno Aquino III, Gloria Macapagal Arroyo, Erap Estrada, and Fidel V. Ramos.
Now, can you tell me the name of the present president and the vice president of the Philippines?
Rodrigo Duterte and Leni Robredo.
Now, what do you think of your illness?
I think my illness is not so serious. It may be because of stress or because of heavy workload. And I don't think I need to stop working.
Patients with psychotic disorders often lack insight into their illness.
What will you do after this consultation?
I will have my lunch further and maybe get back to work.
Now, good, and avoid stress and relax. Now, I will ask you something. What should you do if you suddenly wake up and find a fire in the corridor of your room?
I will look for the fire extinguisher, and if I can't, I will seek help or I will scream.
Now, what are your plans for the future?
Continue working or maybe start my own business.
That's good.
Judgment may be poor in delirium, dementia, intellectual disability, and psychotic states.
Now, please draw a clock and have the hands placed at 25 minutes past 12.
The patient was able to draw a clock and the hands were in the correct position, so that is a score of 10. A score of 5 and below implies that the clock drawing test is not intact, which is possibly caused by cognitive and specific executive dysfunction. Overall, the patient is awake, alert, and aware of his surroundings. He is also capable of abstract thinking, exercises good judgment, and has full awareness of his or her illness.
Now, I have here some items. I want you to name them for me.
Ruler, ring, ball pen.
Now, can you repeat the phrase? Eating ice cream on a hot day can be a good way to cool off.
Eating ice cream on a hot day can be a good way to cool off.
Aphasia is a condition that robs you of your ability to communicate.
Can you read this and do what it says?
Raise your right hand.
Can you write in this piece of paper?
In the case of Gertzmann's syndrome, it consists of dysgraphia, dyscalculia, finger agnosia, and right-left disorientation.
2, 4, 3, 1, 5.
Now is that right or left?
Right hand.
Can you please point to your nose?
Here, there is
Your
no
left eye,
autotopagnosia
your
or
right
finger
ear,
agnosia and right-left
raise your right hand.
disorientation.
Can you recognize this person?
Yes, he's Justin Bieber.
Autotopagnosia or asomatognosia is the inability to locate, identify, and orient one's body parts. Prosopagnosia is the inability to recognize the faces of people in photos.
Right.
This one?
Both.
Left side hemispatial inattention indicates that patients have right parietal lesions.
Can you make a fist? Can you show me how to use a toothbrush and a toothpaste to brush your teeth? Now please copy this figure correctly.
Good morning, Anna. We will do the motor examination today. I'll give you instructions as we go along. Is that okay with you?
Perform the motor examination in a closed room or clinic. The patient should be undressed and stand under an overhead light, noting the importance of privacy, and the undergarments should remain, but at some time you must look under them with patient consent. Inspect the patient in a rostrocaudal manner, then compare right and left. Look for asymmetry, inspect both proximal and distal parts, left and right, upper and lower. Now, checking for the thenar and hypothenar eminences of the hands. They should be full and convex, and the space between the metacarpals, where the dorsal interosseous muscles lie, should be full or only slightly depressed.
Try to put your chin on your chest like this against the resistance of my hand, okay? Okay, let's start. Go. Okay. Now, lower your head. Now try to raise your head back as I resist. Go. Okay, good.
To test for weakness of shoulder girdle, ask the patient to abduct each arm, first by 90 degrees and then by 180. Apply resistance by pressing down on each of the arm. If the patient is weak, press closer to the shoulders.
Now, put your arms up front, then cross your wrists. Resist as I try to pull them apart. Okay? Put your hands on your hips and push your elbows back. Okay? Raise both arms in front, palms up, close your eyes, and hold that position for 30 seconds. Go.
Pronator drift is the pronation of one forearm. It is both sensitive and specific for a corticospinal tract lesion originating in the contralateral hemisphere. Downward drift of the arm with flexion of fingers and elbow may also occur. Look for a pattern in any detectable weakness. Always compare muscle power on both sides before moving on to the next muscle. If the patient is strong, you need to stabilize your shoulder with one hand and provide resistance with the other.
As I try to pull it down.
Extensor weakness is seen in peripheral radial nerve damage and in the hemiplegia of sinus disease seen in stroke or multiple sclerosis.
Okay, good.
Inspect and palpate the thenar and hypothenar eminences for size and asymmetry.
Other hand.
Look for signs of atrophy for interosseous muscles. If motor weakness is present, it is typically evident with weakness of the finger adduction and abduction. While testing for muscle strength, it is important to keep in mind the anatomical information such as nerve innervations.
Resist. Okay, squeeze my fingers.
The patient has a good grip, meaning there is no weakness.
1, 2,
Watch the
3.
umbilicus as the abdominal muscles contract. Quadriceps is the strongest anti-gravity muscle in the body, so expect a forceful response. Inspect and palpate the leg. Check for strength of these movements by manual opposition. Observe the speed, rhythm, and smoothness of the movements. The non-dominant side often performs less well. Note any slowness or awkwardness. In cases of dysdiadokinesia, an abnormal cerebellar disease, one movement cannot be followed quickly by its opposite, and movements are slow, irregular, and clumsy. Finger about so that the patient has to alter directions and extend the arm fully to reach it. An uncoordinated gait with reeling and instability is ataxic. If the patient cannot maintain balance after closing her eyes in conjunction with other neurologic disorder, finding may signify problems in proprioception or the vestibular system. Pay attention to stance, stride with stride length, step height, gait speed, arm swing, and 180-degree turn. In performing tandem gait, we can check weakness of patient when swinging from left to right. It may reveal truncal ataxia. Note that poor performance in tandem gait may indicate problem in proprioception, vestibular function, and leg tremors in addition to cerebellar region. This test may reveal distal muscular weakness in the legs. The inability to heel walk is a sense test for the corticospinal tract damage. Difficulty in hopping may be due to weakness, lack of position sense, or cerebellar dysfunction. Difficulty in doing a shallow knee bend suggests proximal weakness, weakness of the quadriceps, or both.
Good morning, Anna. I'm Doc Carlo. I will conduct your cranial nerve examination. Can I examine you?
Yes.
Some of normal findings would include ptosis, in which the eyelid is lower than normal. Also, lid retraction, whereby the eyelid is higher than normal. Also, look for the position of the eye. Look for exophthalmos, in which there is protrusion of eyeballs, or in ophthalmos, there is a sunken eyeball.
Okay, Anna. We'll start assessing your visual function. Are you wearing glasses?
No po, Doc.
Can you see the clock on the wall?
Yes po, Doc.
Do you have any problem reading newspapers?
None po, Doc.
I want you to close your right eye. Then read the Snellen chart from top to bottom as fast as you can. Start.
Some of normal findings include myopia, or nearsightedness, or hyperopia, or farsightedness. There could also be presbyopia, which causes focusing problems for near vision, and it usually found in middle age and older adults. The causes of reduced visual acuity, which are not usually corrected by pinhole or lenses,
Okay, try the other
include
side.
corneal lesions, ulceration or edema, cataract, macular degeneration, retinal hemorrhage, visual fields, confrontation test. Ask the patient to look into your eyes while you place your index finger just outside the outer limits of your temporal fields. Move the fingers in turn and then together. Then ask the patient to point to the moving finger. Test her peripheral field as well on each eye separately, asking, "Can you see the whole of my face?"
I want you to close your right eye with your right palm. Keep looking onto my eyes. Tell me if the silver color is reappearing or disappearing. Okay?
Appearing po, Doc. Appearing.
Now, Anna will testing your color vision. Now, I want you to read the following plate. Read the number.
Okay po, Doc. 12, 71.
Okay, to shine a light in your eyes.
Yes po, Doc.
Okay, I'll be doing the swinging reflex, okay? Now, Anna, I want you to follow my fingers.
No ptosis or oculomotor lesion, any restriction of eye movement, or nystagmus causing the eyes make repetitive uncontrolled movements.
Now, I want you to bite your teeth.
Difficulty clenching the jaw or moving it to the
I want you
opposite
to bite your
side,
teeth.
such as masseter and
Relax.
lateral pterygoid weakness,
Okay,
respectively.
thank you, Anna.
Jaw deviation during opening points to the weakness on the deviating side.
Please wrinkle your forehead for me. Okay, stop. Close your eyes. Don't let me
Note
open it.
flattening of the nasolabial fold and drooping of the lower eyelid, suggesting facial weakness.
Show me your teeth.
Bell's palsy, a peripheral injury to cranial nerve 7, affects
Okay,
both the
count your
upper and
cheeks.
lower face. A central lesion affects mainly the lower
Okay.
face.
Anna, can you repeat the phrase cuckoo?
Kuku.
Lala.
Lala.
Okay. Can you show me how you sip the water?
If the palate fails to elevate when the patient says "ah," but does not elevate during the gag reflex, the patient might have an upper motor neuron lesion.
Now, Anna, I want you to turn your head to the left. Don't let me turn it, okay? Good. Turn your head to the left. Don't let me turn it. Okay. Now, I want you to shrug your shoulders. Okay. Don't let me push them. Okay, good. Can you stick out your tongue? Move your tongue side to side. Can you smell this?
Yes po, Doc.
What is it?
Coffee, Doc.
Loss of smell or
Thank you.
anosmia
Let's try
occurs
this.
in sinus conditions,
How about this?
head trauma,
So,
when lesions
55, Doc.
Okay.
66, Doc.
Okay. Okay. Tell me when you hear tuning point, okay?
Okay po, Doc.
Can you hear this one?
Yes po, Doc.
Tell me when to stop.
Stop po, Doc.
Can you hear this?
Yes po, Doc.
Tell me when to stop.
Stop.
Okay, good. Now I'll be putting tuning fork in the middle. Tell me where is the strongest, okay?
Okay po, Doc.
Where is the strongest?
Middle po, Doc.
Okay, thank you, Anna. Okay, close your eyes. Do you feel this?
Yes po, Doc.
How about this?
Yes po. Yes po. Yes.
Can you remove your face mask?
Yes po. Yes po. Yes.
Yes.
Isolated sensory loss
Yes,
occurs in peripheral nerve disorders,
Yes.
including lesions of the
Yes.
trigeminal nerve. Seen as patterns from
Yes.
stroke include
Yes.
ipsilateral facial and body
Yes.
sensory loss from
Yes.
contralateral cortical
Yes.
or thalamic lesions, ipsilateral face but not contralateral body sensory
Yes.
loss in brainstem lesions.